And if you look at the curricula in Caribbean medical schools, most of the schools do discipline-based curriculum. That means they do curriculum like anatomy, physiology, or biochemistry, such as discipline-based curriculum. But when you see the what you call questions that you come across in USMLE Step 1, most of these questions are integrated questions. And when you see the curriculum at American medical schools, most of these American medical schools are doing organ-based curriculum. And what they do in organ-based curriculum, they introduce the students to foundational principles of medicine in the first semester. Once the students complete the foundational principles of medicine, they're exposed to different systems such as cardiovascular system, hematology, or maybe respiratory system like that. What happens in the organ-based curriculum in American medical schools, if you are doing a cardiovascular system, you will be covering anatomy, histology, physiology, pharmacology, pathology, and microbiology, everything related to cardiovascular system. But it might be difficult for the students to assimilate and accommodate this kind of information, starting from anatomy to pathology and pharmacology in single semester. Then we thought maybe we should do a curriculum which is between what you call discipline-based curriculum and organ-based curriculum. Then we thought we should design the curriculum like this. So you can see here in MD1 and MD2, you're going to cover two courses, mainly two courses, which are human structure and function 1 and 2, and also molecular basis of medicine 1 and 2. What is covered in human structure and function is like you will be covering courses such as anatomy, physiology, histology, and those courses will be covered in human structure and function 1 and 2. And in molecular basis of medicine 1 and 2, you will be covering courses such as biochemistry and genetics, because we don't want to teach biochemistry and genetics separately. They should be integrated, which we call it as molecular basis of medicine 1 and 2. And the same way, you will be covering anatomy, histology, and physiology together, human structure and function 1 and 2. And you can also see another course which is MBB. MBB means mind, brain, behavior. What does it cover? It covers behavioral science and neuroscience. But in MD3 and MD4, you have another major course which is called Diseases, Immunity, and Therapeutics. This Diseases and Immunity and Therapeutics covers pathology, pharmacology, microbiology, and immunology. So it is an integrated course. But at the same time, from MD1 to MD4, you will be also covering clinical skills 1, 2, 3, 4, and also problem-based learning. So why should we cover like this? Because clinical skills, you will be doing the same system what is covered in HSF 1 and 2, and DAT 1 and 2, you will be doing the same system in clinical skills 1, 2, 3, 4. Suppose, for example, if you are doing central nervous system in DAT 1 or maybe in DAT 2, if you are doing central nervous system, the same system will be covered in clinical skills. But not only the clinical skills, but you also see in PBL, you will be covering the same system in PBL also, which is problem-based learning. Because you know that these clinical skills 1, 2, 3, 4, they integrate clinical sciences in the basic sciences. Because this is very essential for any curriculum, should have what you call vertical integration. What is the meaning of vertical integration? Bringing clinical knowledge into the basic sciences so that students can learn clinical knowledge and basic science knowledge together. That's what we call it as integrated curriculum.